let's dive into the session. Today, we are going to discuss about the topic Disease Outbreak Preparedness, a focus on critical. So, today, Mr. Elvin is here to present. So, over to you, Mr. Elvin. You can start your session.
Okay, thank you so much. Good afternoon to you all once more. Sorry for starting a bit late. Yeah, like I said, we had a technical problem, but yeah, you're welcome from wherever you're watching me. Welcome to this webinar, and today we'll talk about disease outbreak preparedness, and our focus is on cholera. So the whole idea why we're talking about this is in relation to the cholera outbreak that we continue to have, especially here in Lusaka. So the idea of talking about this, we want to, can I just move the, yeah, so I was saying that, so the rationale behind this webinar is we want to prepare our students so that we can equip them with the knowledge on how to deal with the emerging and re-emerging infectious diseases. And also, we want our students to be able to fit in and, you know, perform effectively in any work environment, wherever they're going to work in the entire world. So we train public health students, both bachelors and masters, and also we offer medicine. So my wish is that our students are watching, and this will, I feel, will greatly help them to prepare for their future, wherever they're going to work. So epidemics of emerging and re-emerging infectious diseases are on the increase. When we look at this globally, the recent outbreak that we had of COVID-19 and the numbers of lives that we lost through these infectious diseases is quite high. So epidemics of infectious diseases are quite on the rise, and they've got devastating health, social, and economic consequences, and especially in developing countries like ours, Zambia. So one of the lessons learned was on the same, the coronavirus outbreak, which claimed so many lives globally and paralyzed health systems and the economies the world over. So it is very important that our students understand how to handle these infectious diseases, because the COVID-19 wasn't the last. We will still have more epidemics to come. Okay, so Zambia has been struggling to contain cholera outbreak in the past years. This is a well-known fact as long as you live here. So the cholera outbreak continues to expand and affecting a total of 39 districts in the 9 provinces. So by January 2024, so these statistics may not be as accurate, but this is not our main area of our focus. The focus we're looking at disease preparedness, but these statistics were gotten sometime back in January. So by January 2024, about 8,276 cumulative cases of cholera and 333 deaths were recorded. And the case fatality remained high at that time of about 3.5%, which is opposed to the WHO threshold of less than 1%. Okay, so I'm just giving a background to show you the effect that cholera had on the health systems here in Zambia and also the economy. Okay, so that is just those are 2 images of cholera patients at a treatment center here in Osaka. So we can see the number of beds there, and also, the health personnel attending to the sick. So 94% of all confirmed cases and 97% of all deaths in Zambia occurred in the Lusaka province. The main drivers of the outbreak are the contaminated water, poor sanitation conditions in densely populated urban and peri-urban areas, as well as localized floods caused by rains, which contaminated the water sources in the same areas. So this has been the major contributor of cholera outbreaks. Access to clean drinking water in certain areas of Lusaka has remained a challenge. So these are real issues that must be addressed. Okay, the government, did its best in reducing the number of, mortality, which was a good thing. But we need to do more, especially as people working in the health sector. We've got a huge role to play when it comes to, cholera prevention or infectious diseases prevention. So we'll look at how we can prevent quite a number of people dying from these infectious diseases, because these deaths are preventable, actually. So while Zambia received about 1.7 million cholera vaccines, or vaccination rather, vaccination doses from WHO as commitment measure, the government postponed the start of the school year for 3 weeks, and which was extended later. And the street vending was banned, especially in cholera epicenters. So a new cholera treatment center is established in Osaka for an additional bed capacity for 1,000 patients. And the Disaster Management Authority is also finalizing the revised emergency response plan, right? So just on that, what does that tell you about the capacity of our health systems to handle such kind of outbreaks, right? So if we can prevent outbreaks of infectious diseases, the better. So like I said, we have a huge role to play when it comes to disease prevention. To start with, our health systems cannot handle the ever-increasing number of people getting infected with these infectious diseases. That's why you saw the government using the initiative of creating the stadium as a treatment facility, which in the real sense, in my opinion, I think that should not happen. We should have a specialized hospital dealing with infectious diseases going forward. So talking about the vaccine, that is a girl child receiving a vaccine of cholera, donated by well-wishers. And we look at the role of global collaboration when it comes to disease, the fighting of diseases. So then, what is disease outbreak preparedness? So disease outbreak preparedness is a critical aspect of public health planning and response to minimize the impact of infectious diseases, such as cholera, on individuals, communities, and the healthcare systems. So we want to minimize the impact of disease, okay, on individuals and the communities that we live in. And also, we should lessen the burden on our healthcare system or systems, which, in most cases, would not handle those huge numbers of people that are getting infected. Outbreak preparedness involves ensuring systems and plans are in place at both national and community level for detecting an outbreak early and implementing an effective response. So if we prepare for disease outbreak, we'll be able to detect disease outbreak on time before the disease can spread into the communities we live in. And that way, many deaths will be averted, which is a good thing. So this requires a multidisciplinary team and a multi-sectorial approach. So allow me to read an extraction from the website, the Zambia National Public Health website. So stopping cholera at the pass requires a strong national public health system, and this is a part of the vision of the new Zambia National Public Health Institute. So its response to a recent cholera outbreak gave Zambia National Public Health Institute an opportunity to identify strength and to set priorities as it develops Zambia's first public health emergency operations center. So it is it's a good thing that it is underway. The government is planning to set up this public health emergency operation center, which is a very good thing. It's a positive move in the right direction. And this is a reason why I decided to focus on disease preparedness so that we can equip our students with the knowledge on how to handle these emerging and re-emerging infectious diseases, right? Because it's our students who are going to work in such centers. Okay. So the extraction goes on to say we did not expect cholera outbreak would be this big. We mobilized ourselves and opened a cholera center. Whatever we did here can be used to do better. So there's opportunity to improve, right? We have cholera outbreaks year in and out, here in Lusaka especially. So this should not be allowed as a trade that we use, that we're going to have cholera, right? We can do better. We can do better. We can reduce the number of people dying from preventable diseases like cholera by improving, hygiene and also sanitation. So this was, mentioned by a representative from the Zambia National Public Health Institute here in Osaka. Then in June, somewhere the CTC and the International Association of National Public Health Institutes traveled to Lusaka responding to a request by the Minister of Health, meeting with newly appointed the director, talking about the director for Zambia National Public Health Institute and his team in order to do what? To build this public health emergency operation center. So with this, I feel going forward, we'll be ready and prepared to fight the cholera epidemic in future. So for us to understand disease preparedness, we need first to understand the epidemiological triangle. So what is this? The epidemiological triangle, or triad as it is called, is a conceptual model used in epidemiology to understand the complex interplay of factors contributing to the occurrence of disease in populations, right? It consists of three components, and these components are crucial in understanding how disease spreads from the environment or from another host And yeah, like that, from the environment to humans, or from humans to other organisms in the environment. So these three components are the hosts. So the host refers to the organism, like a human being that carry disease. Okay, so a human being that carry disease or gets infected by the disease. Then factors that affect the host or a human being, these may be genetic, right? Certain people, as a result of the genetic makeup, they may be susceptible to, acquiring certain disease. Then age also is another factor. If you talk about diarrheal diseases, yeah, children under the age of 5 are more at risk of having cholera or diarrheal diseases. Then also sex, eventually being male and or female, you're more likely to get certain diseases. And then also the immune status of a person and the overall health of an individual. So this is how the epidemiological triangle looks like. So this is a host, mentioned this is a person, right, that is affected by disease. Then this is a causative agent, okay? So in this case, the causative agent, in the case of cholera, it can be the bacteria that causes cholera, right? Then the environment. So the environment here, we can talk about contaminated water, contaminated food, right? So you can see the movement of those arrows. So the host can acquire the causative agent, the Vibrio cholerae, that causes cholera, by ingesting food that is contaminated. And that food is found in the environment, right? That's why one of the strategy was stopping people from selling, food in the streets, which might be contaminated. So the agents, yeah, like I said, is the causative factor or the pathogen that leads to the disease. So it could be a virus, it could be bacteria, it could be a parasite, or any other microorganism that can cause illness. Then the environment, this includes all external factors. So these external factors, they influence both the host and the agent. And these include the physical environment, biological, social, and economic factors such as climate, living conditions. Here we may give an example in certain areas where cholera levels were high, like Kanyama, where they usually have floods during the rainy season like this one. And those floods, mixed with the drinking water, there are trains everywhere, and those latrines, when they get flooded, they mix with drinking water, creating a hostile environment or a breeding ground for the cholera bacteria. Or they can be, also socio-economic status and also cultural practices. So how does understanding the epidemiological triangle help us understand how disease moves from one organism, from the environment to one organism, to an organism, and then to another, and so on. This helps us, to understand how these three components interact, and helps public health authorities develop strategies to prevent and control cholera outbreaks, right? If we understand the transmission mechanism, then it will be easy to stop the transmission. Then also understanding the epidemiological triangle helps, interventions such as improving access to clean water, promoting sanitation and hygiene practices, implementing vaccination campaigns, enhancing surveillance systems, very crucial for reducing the burden of cholera and preventing its spread within communities. Okay? So, what are the key components and strategies for effective disease outbreak preparedness? Number one, we need to understand the risk. We need to understand the risk. So we do the risk assessment, disease risk assessment. So regularly assess the risk of potential epidemics based on factors such as global trends. We may talk about how the disease is moving from one country to the other. How quick is it moving? Like we saw the way COVID was able to reach different corners of the world within a short period of time, right? So we look at those factors. Then also population movement. It's a global world, right? People are moving from one country to the other. So as people move, they may carry these disease-causing organisms, you know, and introduce them to the new population or a population which does not have the particular infection. Then also environmental changes, right? You know, with what's going on right now, the talk about climate change issues where the next time we have rains, then we go, the next time we go 2 weeks without rains and so on. So the sources of clean drinking water become a challenge in certain areas. So all these are ways we can assess the risk. Then we look at surveillance and early detection of disease. So surveillance is all about establishing robust surveillance system, which are able to assist us monitor and detect potential outbreaks on time. So the different types of surveillance, we may talk about passive surveillance. So passive surveillance refers to disease reported by healthcare providers, right? This might be through lab reports, and other screening services. Then there's also active surveillance. This one involves the targeted investigation where we target particular cases, right? Then also case reporting, like what used to happen during COVID. You hear if, let's say in Bowling Clinic, maybe we had 2 deaths as a result of cholera. They will announce like that. They will send information to the responsible center so that we can know how and monitor how this disease is moving in the population. So this is what it entails by case reporting. And also it may involve obtaining patients' information such as demographic symptoms or other characteristics, symptoms, lab tests, and so on. Then we can also use advanced technology in surveillance for data, for analyzing data, and also real-time reporting to identify unusual patterns of disease, right? So this helps survey disease movement. Then also we can use also electronic health records. So this provides real-time data sharing among health workers, right? Then also you can use a geographic information system. So this helps identify patterns and clusters of disease. Then also developing communication and reporting systems that are efficient and secure, right? Making information be able to reach from one health facility to the other. Then also alerts and notification I'm sure you during that time, even up to now, you're still able to get alert or notification on your phone, which the Ministry of Health uh, you know, did a good job when it comes to that, which was a good thing, right? We're able to get notifications to, sensitize you and make you aware of cholera, messages of cholera prevention to remind you to wash your hands, and make sure you drink clean and safe water or, coordinated water and so on. Then also it may involve capacity building, training other healthcare workers or professionals on issues to do with surveillance and also data collection, disease data collection, and so on. Then also developing a rapid response team is very crucial when it comes to disease preparedness. So this involves formulating and training rapid response teams capable of deploying quickly to affected areas, right? Deploying human resource, medical personnel to affected areas so that disease can be quickly arrested. Then also develop protocols for the rapid deployment of medical and logistic support. Yeah, there are a lot of things that might be needed depending on the disease, right? To know the mode of transmission, know the mode of prevention, so logistic support, we may talk about, the screening instruments, if I may call them, or tools. We may talk about vaccines. We may talk about, human resource itself and so on. Then also public health, disease preparedness also involves public health, securing public health infrastructure that is strengthening healthcare systems, including hospitals, clinics, and laboratories to handle increased patient loads, right? So earlier I was just talking about, strengthening healthcare systems so that we can have the capacity to handle the increasing number of people with a particular disease. It might not be cholera, it might be any other respiratory disease and so on. Yeah, so there must be proper infrastructure, okay, which will be well equipped to handle cases to do with infectious diseases. And also, it might involve, equipping laboratories so that there's early detection and the screening and so on for those infectious diseases. And also, it might ensure an adequate supply of medical equipment, also medicines, and the protective wear to prevent health workers from, getting infected instead of treating patients. Then also vaccination programs. So also again, here we saw how many vaccines were received during that time, and this greatly contributed to the reduction of number of cholera cases, okay? So here we're talking about, vaccinating the people in cholera epicenters so that, it might reduce disease, the disease spreading to other parts. Then also communication strategies, developing clear and effective communication strategies, disseminates accurate information to the public. What information? Information about disease prevention, like what I talked about of those notifications and alerts on how to prevent cholera by washing your hands, following those practices. Then also international collaboration. We saw how other countries came in to assist fight the cholera epidemic, which was a good thing, right? So collaborate with international organizations, governments, and also NGOs to share resources and expertise, okay? Then also support developing countries in building their capacity for disease surveillance and response, okay? Then also research and development. So it should be a wake-up call under the area of research, right? Why is it that we keep on having cholera year in, year out? What are some of the strategies that we can use? Okay, so this might go for research, okay? So in order to arrest this situation so that we don't have, recurring outbreaks of cholera. Then supply chain management, this one involves developing resilient supply chains for medical equipment, pharmaceuticals, and other essential supplies that may help with fighting a particular infectious disease. And also identifying alternative suppliers and distribution channels in case of disruptions, right? Cases where vaccines, for example, have run out, must have alternative suppliers that can supply you with vaccines within a short period of time so that the outbreak is contained effectively. Then also community engagement, very important, because the people that gets affected or die as a result of these infectious diseases are people in the community. So they must be involved in the fight or prepare in the preparation of a disease outbreak, right? Because of the people that get affected most. So they must be involved in the planning response, in the planning of disease outbreak. Then also to address cultural and social factors that may impact the effectiveness of public health measures. During the time the cholera outbreak was at peak, I remember hearing on the news some pastor somewhere, I think that was in Kafue, was stopping his congregants from receiving the cholera vaccine. So such kind of things. So these are cultural and religious factors that might affect the uptake of public health measures that might help abate death. So such kind of issues must be addressed when you engage the community. Then also flexibility and adaptability. So this is all about building a flexible or build flexibility into preparedness plans to adopt evolving solutions or situations rather, because situations are always changing. So it must be flexible to adopt new strategies that work on fighting disease. Because you're aware right now that there's so many emerging public health issues like microbial resistance, so certain microorganisms might not be treated with certain old methods of treatment. They require new strategies or new treatments. So you must be flexible to adopt to new solutions or new situations, depending with the particular disease that you are dealing with. Then also continuously update and refine response strategies based on lessons learned from previous outbreaks, right? We are learning something new every outbreak, and these lessons should be, used to better ourselves or to reduce the number of people dying. So in summary, epidemic preparedness require a multidisciplinary and collaborative approach involving governments, healthcare professionals, researchers, communities, and international partners. So regular evaluation and refinement of preparedness plans based on emerging threats and lessons learned from previous events are essential components of an effective epidemic response. So by addressing the above components, governments, healthcare organizations, and communities can enhance their ability to effectively respond to and mitigate the impact of disease outbreaks. So I would like to end here. If there are questions or contributions, you're free to ask. Let's share ideas. Let's educate one another. We learn from one another, which is very important. The moderator, maybe you can take it up. All right. Okay, so there's I don't know that's the comment or a question. Let me just read it. So somebody has written this rather. So the government of Zambia intends to redesign some shanty compounds such as Misius, Chibolia, and also encourage some residents to go back to the rural areas. Okay, so what do you think such a measure would do to bring down the community death due to cholera since the English, I don't know, cholera death happened in the communities compared to those in health facilities. All right, so somebody's asking, saying the government tends to redesign these shanty compounds where cholera is really a problem, because in most cases we have outbreaks in these shanty compounds where there's unplanned settlements. Okay, so encouraging people to go back to rural areas, I think that might not be a proper alternative. You know, people have come here to Lusaka to stay, and they've got families, they've got relatives. I think the best solution would be to do the redesigning without, you know, evacuating or chasing people, you know, creating a proper water networks in these shanty compounds so that, you know, we prevent cholera outbreaks in future, right? So I don't know what others think. I know there are other people that are directly involved in these issues. You can come on board and share your ideas.
The polls has been launched. Attendees are requested to take part in the polls.
So I hope I've answered Mr. Timuka correctly, or I've exhausted my answer. Question. Thank you. How about the camera? I can't see the options. So in an event, some centers have no readily available laboratories. How do we test cholera samples? So if you remember when I was explaining key components of disease outbreak preparedness, I mentioned developing effective communication strategies and also establishing proper logistics, right? So the logistics include, you know, making available transport those samples to areas where there are already existing laboratories for testing. Then the other question there says, how is the cholera vaccine uptake in the community? So on this one, I might not answer directly because I'm not directly involved. I'm not sure. I don't have those statistics to say, to give you like how many People have accepted to take this vaccine, but I should believe the government did a good thing by introducing the vaccine, and of which I believe it is because of this vaccine that the numbers of cholera cases have gone down. Yeah, that would be my answer. So the most important thing that we should be happy about is that we've managed to contain the cholera outbreak, and everything now is going normal, which is a good thing. But as individuals, we should do, take up the responsibility, to ensure that we adhere to the government policy and regulations, which is very important, right? Because most people in our communities might not be aware or have the knowledge on how to prevent certain diseases. And the government provides this information. Okay, that's why I was talking about receiving those alerts, the message alert on your cell phone, which is a very good, positive thing. And you might not have somebody to educate you directly, but through your cell phone, you can read those messages. So that is part of disease outbreak preparedness strategy that the government did. So I'm talking about this in the public health, domain, just about, disease prevention. So, yeah, thank you so much for listening. I believe you are able to get one or two things from what I've talked about. Let's continue to follow the government regulations by, adhering to good hygiene practices so that we stay safe and, prevent diseases at a household level. So we'll meet next time. Have a good day.
Yeah, thank you, and a big virtual thank for each and everyone making our webinar a success. Your patient engagement were truly appreciated. We hope you find the session informative and valuable. So thank you so much for joining us for the today's session.